already the government is a very big supporter because when we need to upgrade our medical services or buy equipment, it always facilitates. The government does not come in the way of growing the specialization. Secondly, we are able to send out doctors for further training and specialized training. And our government is very supportive in that particular regard, because the growth of medical tourism will come when three things keep improving: the skill of the doctors in various specialties, the availability of technology and equipment to provide that care, and of course the provision of other auxiliary services like laboratory, pharmacy, and other areas. Now these three are constantly evolving and constantly growing, and therefore the more that our government supports both public and private sector in getting these three things aligned, the more we are able to specialize, the more we are able to provide more specialized care to patients, and the more we are able to invest, because remember, medical is also an investment. We buy these things and we spend to train doctors. So the more the government supports that, the better. And the easier it is for hospitals, both public and private, to become more and more specialized. And when we become specialized, we are then able to offer that service to more and more countries. The other part that, and I always refer back to the tourism aspect, because for that patient to come, say, from Uganda, remember they have to travel here. So you're looking at border controls. How easy is it for that patient to come here? How easy is it for them to find accommodation? Because rarely does a patient come for specialized care by themselves. They will tend to come in the company of family and friends. And so the government plays then a big part in making it easier for these patients to come into the country, to stay in the country, and find whatever else they need besides the medical care. So it's still a two-pronged approach, but the government of Kenya has definitely done a good job in this area and continues to do so. And so it continues to be a strong partner for us, both on the tourism side and the travel side, because there's a travel. The patient has to travel to come here. But the easier it is for patients to access the country, the easier it is for us to develop our specializations, the easier it is to grow the industry as a whole.